The patient is now part of your team. They're helping you as well as you helping them. My doctor saved my life in giving me the medication. She gave me a life in teaching me how to do it myself.
Welcome to The Conversation. On today's episode, Johnny is speaking to Dr. Mohammad Al-Ubaydli, CEO and founder of Patients Know Best, the UK's leading patient-held medical record company. We hope you enjoy the episode. Be sure to subscribe and follow us on social.
Mo, absolutely lovely to have you, sir.
Been looking forward to this. Thank you, John.
Give us a little introduction to yourself and a bit of background.
My name is Mohammad Al-Ubaydli. I'm the co-founder and CEO of Patients Know Best. My background is a physician and programmer. I wrote 6 books about IT and healthcare. I'm basically a nerd, and in 2007 I was asked to write a book about giving patients their medical records. And because I'm a patient myself with a rare disease, I became obsessed with that problem. So I started the company in 2008. We give patients their medical records.
What is the current state with electronic patient records, and what does that mean for patients?
So the records are digital, so they are electronic, but very few patients have the actual record in their own possession. So the typical path you may have is you go and see your doctor's writing something. It's definitely digital, it's definitely computerized, definitely modern. And you say, so what's happened to me, doctor? And they say, you're fine, or you're not fine, I'll bring in another doctor to have a look at you. But what did you see? What's the number you have? What's the treatment I'm getting? All those details. Most people don't get most of those details. And so what we do is make it easy for the medical systems to give you an electronic medical record and for you to use it to understand your health and help the people who are working on your health for you.
So if you were to describe Patients Know Best in a nutshell, what would that be?
The company Patients Know Best, our mission is that you know best. So that's my day job. It's making sure that you've got all the information, all the people, all the understanding, so you know what's happening in your body and what you need to do about it. Now, how we make that happen is that it's a medical record system. So we get paid to release all your data from our customers. So when you go to your hospital, we'll release 20 million test results every month. When you go to your GP, we'll get you your diagnoses and medications. But the whole idea behind the system is that we get you all your information, because when you have your information, you can know best. You can start figuring out what to do next with your body.
How have you found navigating the digital landscape of the NHS? Presumably, that comes with a certain set of challenges.
Yeah, there are photos online. I did used to have hair when we started this process. It's really complicated to do this right in healthcare. It's not just, doctors are old-fashioned or anything like that. They're all quite modern. They use CT scans, precision surgery, and so on. It's just doing it with data has lots of problems that you have to make sure you fix. Are you doing it securely? Are you doing it with the right privacy? Are you looking after vulnerable people? Most consumer businesses, if you cover 95% of people, you're all right. Healthcare, the 5% is where most of the work goes on. The people who need help, they can't look after themselves. Are you managing their safety? Are you bringing in the people who look after them? And then are you making sure everyone works faster rather than adding to their workload, because the clinicians are already crushed with all the workload they have. Now, when you do it right, you are helping everyone in the system, because the patient has ownership, they have agency, they start doing things, which reduces everyone's workload, and they do it safer, faster, cheaper. But to get to that stage, there's a million things you have to get right. And so when we started in 2008, everybody assumed it was impossible. In fact, they categorically knew it was impossible and said that to everyone. So we had to find innovators who are willing to do the small experiments that you layer on then to get to the large scale.
Yeah, it's one of the consistent themes that I've heard a lot about how you get adoption is those small incremental improvements, those little experiments that you pilot, and then you take them further and further and ultimately achieve a larger scale intervention. You spoke there about vulnerable populations. What does that look like in terms of the work that you're doing, accessibility-wise, and all of that sort of stuff, to make sure that those patients, as you say, that 5% who are those people that in the healthcare setting and system do need the most care? What's the focus there? What does that look like from Patients Know Best perspective?
So we started with children, Great Ormond Street Hospital, and they treat some of the sickest children in the country with some of the most complex conditions in the country. So they need a lot of help, but they're also vulnerable just from their surroundings. And one of the first families that used this was actually homeless. So they couldn't get letters at home about their care, but they could go to the library computer and get the message. Some of the patients didn't speak English, or at least their parents didn't speak English. And it was often the child who was operating the system for their parents, with great joy, by the way. They really enjoyed clicking around for their mum. The system works in 22 different languages. It works for screen readers. A lot of this is about having enough time to do things slowly. So the 10-minute appointment with the doctor, which is really rushed. Did you get everything? Did you understand everything? You only think of the questions when you leave. Actually, if we give it to you in writing and you have it with you afterwards, you can read it with your family. You can ask for additional help to explain things. There are surgeons who are putting videos explaining what the operation was, rather than telling you just after you have your operation you're still waking up from your anesthetic. There are children with epilepsy where the family records a video of your seizure and uploads it for the doctor, because the alternative is you have to bring the child in for 2 days or 3 days in the hospital just so you can witness the seizure and make sure they get the right diagnosis and treatment. So all these situations, there are people with difficulties not just because they're sick, but there's also a lot going on in their home where you need to protect them as well as implement all the legislation around that.
Wow. So you're really facilitating almost a two-way dialogue between the clinician and the patient. So it's not just that one-way traffic that you're relying on, that 10-minute consultation, and you actually get more insight, more of a dialogue rather than kind of like a one-way piece of traffic. What are some of the most exciting innovations that are on the horizon that you're really looking forward to?
I mean, John, on the collaboration you're talking about, so when we started, the user interface was full of sort of propaganda about that way of thinking. So what we now have as a sharing page was called the team page, because the patient is part of the medical team. And what we now call the messaging page used to be called the discussions page, because it's not just the doctor sending a message, there's a discussion that's going to go back and forth. And so we're trying to bake it into the medical team that the patient is now part of your team. They're helping you as well as you helping them. That's a difference in their relationship. The thing I'm really excited about coming out in June, which I think may be close to this podcast time, is we will get a person's record from anywhere they are in England. At the moment, we can only give patients their records if they're linked to a customer. So about 25% of the UK's hospitals use this. We release 20 million test results every month, and we register 100,000 people every month. But from June, anyone who uses this anywhere in England, even if they're not tied to a customer, will get their GP record for the patient, and then the patient can decide what to do with it. And then we can start doing clever things for them. So not only will we say to you that you've got insulin for your diabetes, we'll tell you, actually, given that you've got insulin for your diabetes, there's a new drug that the government wants every person to be on. They want everyone to have a continuous glucose monitor. Go and show your doctor this guideline because you qualify for a monitor. Or given that you're this age with prostate cancer, there's a clinical trial in your area. If you're interested, click here and tell the people that you have this diagnosis and you want to enroll in their trial. So from June, that's what's got me excited. We can do this for anyone in the country, and we can let them do things for themselves that were never possible before.
That's absolutely incredible. So you're really bringing that almost consultative layer into someone's pocket, where they can actually have some guidance and advice.
Correct. And the thing is, since we started, it's been a really long slog to get to that situation, get everyone's trust, do the integrations, get the data, and so on. But in that time, technology's improved so amazingly. So the things you can do now with that layer are really impressive. So the phones now have incredible sensing technology at home. As a simple example, so this ring I've got can check my glucose, for example, as well as my oxygen, as well as the usual sort of Fitbit walking. We already know that phones can detect your Parkinson's early from changes in how you walk and changes in how you talk, well before you ever see a neurologist.
Yeah, and I think it's something like 7 years was the time if you've got a regular measure. It's mind blowing.
Right. And the flip side is, well, with this flood of data, we have tools to manage it. So all the AI can pick out who needs help and who's okay by themselves. So you can focus the clinical time on those who need it, knowing that the others have got what they need to take care of themselves. And then ChatGPT got launched, right? So just the whole set of possibilities, the rate of evolution is amazing. So what all these things have been missing, the sensors, the AI, is a data set to act on. And that's what we've spent our time liberating.
Yeah, you've got this wonderful ability to, I think, straddle both camps as a technologist, developer, but also as a doctor. How are you finding those conversations? Because actually one of the things that, from the conferences and the things that I've been to, there is this fear of AI to a certain degree, and there is also a want. It's a real tightrope to walk. How are you finding engaging in those conversations? How are you bringing people on that journey with you?
So in general, combining disciplines, I think that's the most interesting thing you can do in life. So a lot of young people, when they come for careers advice, I would just say, I don't care what two things you do, just pick two things. Because when you're at the interface of them, all the interesting problems happen there, and then you'll end up building something interesting. So in my case, healthcare and technology is what I love. Now, I'm going to show my age, but when I was in medical school, we had these Palm Pilots, just computers. People were saying that was going to de-skill doctors, and it was going to do bad things. It just keeps on changing every generation. I think every technology, of course, it can be used badly. Our brain is wired to look for the danger, by evolution. But also, every technology, we figure out the bad bits and we get rid of them, and we double down on the good bits, and that generates big benefits. I don't need to join the hype around AI, but it is. I think it's amazing. What I will say is that we cannot continue to offer universal coverage to everyone. So you're making sure that everyone in society has got free medical care when they need medical care, regardless of their ability to afford it. We cannot do that with the existing models of professionals having to do everything. So you need the sheer scale of what's happening, as well as aging, as well as the inventions, all the new medications and so on. You need a step change in productivity. So AI in being able to sense and act is necessary, and phones in terms of changing people's behavior, so they can tell you at home what you need to be doing because they can see it and they can influence it. Those are two key technologies, and we need those to continue to offer everyone universal coverage.
Yeah, I think it's less about a panacea or a silver bullet. It's more about leveraging digital technologies to scale human intervention. And realistically, they just give you the read whereby your clinician or expert can intervene and give you a best course of action.
Yeah.
And so the kind of, that's what I hear from the way that you talk about these technologies, which is fantastic. From the perspective of the patient, what do you see as some of the potential impacts that through the work that you're doing, through some of these changes, that they might begin to see in real world context?
So I'll just tell you a small story about myself. So the way I was able to interpret the medical records things in 2007, which is based on my experience as a person with a rare disease. So I used to, before I was given the right treatment by my doctors, I used to be off school a third of the year. Then when they diagnosed me and gave me the correct treatment, I could go to school. I was back to approaching average height. I wasn't having infections anymore. And the key was they would give me an injection every 3 months, 3 weeks. I'd stay in hospital for a day. And that saved my life. Right? But then one day a nurse came by and said, do you want me to teach you how to inject yourself? Which I was really scared of. I went to medical school, but before then I was scared of needles. But I felt too embarrassed to tell her that I was scared of needles. And so she taught me on the spot in 5 minutes. And then I could inject myself without coming to hospital. Now, my doctor saved my life in giving me the medication. She gave me a life in teaching me how to do it myself. And then I could be independent, I could travel, I could go to university, I could get married, and so on. Now, multiply that by 100 to 1,000 when it comes to information. So every person, if they had the right information, they could build up the right skills to look after themselves. Not everyone wants to do it, not everybody physically is able to do it, but a lot of people can. And so information allows the person to self-assess and self-manage. And that's not just cheaper and safer and faster. It transforms how you feel about your own body, how you feel about your own health. One of the first children to use this in Great Ormond Street Hospital, the consultant told me, I'm so pleased that he's using Patients Know Best, because he wouldn't talk to me beforehand. They bring him in to see me in London, and like every grumpy teacher, like I was, you hate being sick, you hate reminders of being sick, and he would just sit in my clinic, sulking and silent. And it's because he was coming into my world, being dragged into it. When he had PKB, he was messaging me, and I'd reply to him, and he was now engaging, paying attention, changing his behavior. And it's because I was coming into his world. It's his body, I'm in his system, he's in control. So then he starts paying attention, he starts doing things for himself, and that's what she wanted for him. As he approaches adulthood, she wants him to be independent. And so for him to have that agency, he has to have that control. And so that's what information permits. That's what you scale up across every part of healthcare.
Yeah, it reminds me actually of something that I was talking to someone about over the last couple of days. They have a robotics company that essentially provides patient medicines at home. So you can keep patients at home, but in the right dosages with alerts and alarms and this and that and the other. And it is all about that. It's bringing medicine into their setting, into their world, and into an environment that means that they're comfortable and feel that they're not, as that young lad was experiencing, going into a situation where he didn't want to be there. He didn't want to engage and was miserable. Equally, I can imagine there's quite a lot of people who feel that way, and they would rather be at home than in a hospital or a care home setting. And I think that is a huge psychological safety aspect of things that you bring to people in that situation, and that creates that much more engagement with their health. What are some of the future-facing plans that you've got for PKB? Obviously, we've spoken about this amazing aspect of things that's to come in June, but are there any future-facing visions, expansion? Talk to me a little bit about what your future-facing vision is for the rest of the year and indeed into the future.
So we're trying to bring this to everyone in the world. We started in the UK just because we wanted to get it right in one country, and when you prove the numbers, you prove the outcomes. We always thought every government in the world would insist on this for their citizens. They need it for the 21st century, but they didn't believe it was possible. So having spent the last 15 years proving this in the UK and the Netherlands and Ireland, my focus this year is on bringing this to as many people as quickly as possible. So I'm focusing on the Gulf, just traveling a lot back and forth because they learn a lot from the UK, and they have an interesting approach to deployment because they're more top-down. So the 15 years in the UK have been department, then hospital, then region, then government, and so on. In the Gulf, I'm trying to just work, let's do this properly at country scale from day one. So it takes a while to get going, but once it's approved, it will be done at country scale. And then and then we'll just go east. So I think Asia is where a lot of there isn't legacy in there, so a lot of the innovation can happen. And as a small example, when it comes to building AI models, UK is one of the most diverse in Europe in population. 13% of the country is foreign born. USA is 25% foreign born. Saudi Arabia is 50% foreign born. UAE is 80% foreign born. So the genetic diversity there is much greater. And so if you're trying to develop a drug, if you're trying to develop AI, you have a much more universal, representative data set to work with. So you can build global solutions from the Gulf that hadn't been possible in the past in Europe or even USA. So that kind of thing gets me really interested.
That's absolutely amazing. I knew that the statistics in certain, I didn't realize that the UAE was as high as 80%.
Yes.
That is an incredible amount of data to work with and a diversity of data to work with. And as you say, that would have massive implications for potentially pharma companies that are seeking sample sizes that would be more representative of different populations. You'd start to see hopefully some shifts in terms of traditionally underserved and underrepresented populations actually having more ability to participate in clinical trials and things like that. That would be absolutely huge. So you being able to facilitate that as well through PKB would be absolutely amazing with that knowledge transfer. One of the questions that I had further to that was, as you're looking to expand, and you touched on it briefly, you spoke about legacy systems. Obviously, in the UK, we are still dealing with some legacy. What were some of the biggest challenges that you've had to overcome in the early days? And you're probably through a lot of them now, but there still are some. What were some of the biggest challenges that you initially found, and how did you overcome them? How did you engage people? And because in the challenges are often the learnings, right? They're the things that are the golden nuggets of wisdom.
Yes.
What were some of those challenges that you faced, and how did you overcome them?
So I'll tell you, when I started, I went to my doctor, the doctor who'd given me the medications and had always been supportive of me, knowing my health information, and put that nurse in touch with me that taught me how to look after myself. And I said, I want to do this. Said, yep, this sounds great, Mohammed. I completely back what you were saying. I don't think I'm allowed to do this, though, because of the Data Protection Act. That's before GDPR. And I looked at him, I said, no, doctor, the Data Protection Act means that no one's allowed to get my data except me, as opposed to what you're thinking, which is I'm the only one not allowed to get my data. But there was a lot of complexity that confused people, and it was just non-stop barriers. So somebody thinks it's not legal, somebody thinks it's not safe, somebody thinks it's not affordable, somebody thinks it's not efficient, and you have to go through these one by one and prove them one by one. That nurse who taught me, I went to her and said, we're going to do this. And she said, again, I completely love what you're doing, but if this works as I think it should and will, and so you're able to look after yourself, we won't get paid anymore, because we only get paid for seeing you in the appointment. And I want you to not have to come to an appointment. It's good for you. It's good for the hospital. But we won't get paid, so I'm going to have to get rid of the nurses. But I need the nurses. But the payment model was only on the appointment. It wasn't on the new model where the person can get care from home. So multiply this by 100 different things. And so it was a long process to navigate it. And really all we got was 35 children in Great Ormond Street, 300 HIV adults in Chelsea, Westminster and London. And you keep going, little pilots with innovative doctors. Our big break came in 2015 when they said in northwest London, 2.4 million people, we need something that scales across London, but does it work? And we had so many tiny pilots going on parallel that we always said, look, it does every disease, does every population, does every payment model, so it can scale. And that was the proof they needed to then, that was the first population where the patients were in control of the data. But it took from 2008 to 2015 to do very small scale and very low payment contracts to prove that it works.
Yeah, 7 years is an awfully long time, but that seems pretty consistent with a lot of what I've heard in terms of getting something into the system. If you could facilitate some changes within that current system, as you say, other geographies, it's much more top down. You're not dealing with so much legacy and the hoops that you have to jump through. If you were to implement some changes that you would see, reach greater adoptions of digital technologies and solutions that could be of greater benefit for patients, Do you have any kind of like read on what those might be? How would you address some of those challenges with the benefit of the experience that you've had over the course of 16 years?
I think if we had a law that all um, a copy of every interaction you have with the healthcare system must immediately be made available to the citizen in a digital, i.e. easy to compute way. If everybody knew that had to happen, and that was it was on the ground for everyone, not only would that be cheaper, you've got everything digital and so on, but a lot of the friction that we have is in people thinking that they can avoid it if they can come up with a reason why it mustn't happen. But if they just knew it's happening, and they could go through to acceptance, they would then start saying, well, given that it's happening, what are the upsides? How can I do it in the best way? And so that's the one thing that our school... We've made our deployments by cajoling and convincing people that it was in their interest to do that.
Yeah.
We hadn't had top-down support, but I think if there was a top-down mandate for that, that would save everyone's uncertainty, and then we'd just get on with it and do it.
Are you doing any work around digital confidence and literacy for, we spoke earlier about those vulnerable element of the population and some of the challenges that they face in some cases, obviously, is a lack of digital literacy. And I prefer the term digital confidence, because I think if you,
Yes.
it's not about illiteracy, it's about just confidence to use these services. Are you doing any work around those areas to help bridge the gaps for those vulnerable populations? And what is that, if you are?
So I love the confidence aspect. That really is the gap. So one of the things that our innovative customers do is they bring in the third sector, which isn't part of the healthcare system, the professional system. And they're the ones who really build up confidence. So in Northeast London, for example, they're working with patients with severe mental illness, and obviously those people have a lot of difficulties in their lives, whether it's from housing to the illness that they're struggling with. And they brought in the charity sector, so people who volunteer to work to give support to these vulnerable people. And normally those people are completely locked out of the NHS, so although they can help, they're not allowed to help. But if the information is with the person, and the person seeks help from the charity, then you've suddenly brought in the voluntary sector to do a lot of that support. And I think that's only going to increase as we liberate the data from the hospital systems, the GP systems, and then the person can bring in all these people who help them with their confidence. I think that's what gets me excited about the next couple of years in the UK. It's bringing in all these people who contribute to your health, but are not part of the formal healthcare system. Whether it's the pharmacist or the supermarket, your family, the charity, all these people have a lot to do to affect your health. And they can get to do it now because they can, with your permission, get to look at your information and help you out with what you need to do next. I will say one thing, John, about on the confidence bit. When we started in Great Ormond Street, I remember the doctors telling me the patients can't understand this. Someone's going to need to train them. So I sat and personally trained those families, but they wouldn't let me talk for more than 5 minutes. They would just take the mouse away and start clicking around. And this 7-year-old boy, and he said, oh, it's just like Facebook, it clicks around. And I realized then that the problem wasn't the confidence of a lot of the patients. It's that the doctors weren't actually confident. They didn't know how to use Facebook. And so they assumed the others didn't know how to use Facebook, and they projected their lack of confidence or technical incompetence onto others. So a lot of our early efforts was to get the clinicians' confidence up, and then they would recommend this to their patients. But once you're through that bit of confidence, now the next bit is all the remaining consumers who haven't got that ability or confidence or opportunity, you bring in everyone who can support them.
Yes, oftentimes your assumptions are reflections more of an internal situation, and I think that's something that I was hearing yesterday in particular at the digital healthcare show. There was an amazing talk by a guy called James Freed, and he was talking about the level of digital confidence and literacy within the healthcare organizations, obviously in NHS and things like that, and highlighted the importance of equally bringing that confidence to the professionals working within that system as much as the patients who are being served by it. And that's something that you've just really lovely, in a really lovely way, articulated there in terms of giving those guys the confidence to be able to trust their patients a little bit, to actually know that with a little encouragement, they would be more than happy and more than willing to invest the time. If we took a short, medium, and long-term time horizon, what would you like to see happening over the next, over those time horizons? Short, I don't know, let's just say short is kind of 12 months, medium, 3 to 5 years, and then 10 years for the long. What would you like to see happen within that time?
So in the next 12 months, we've got the GP functionality, so we give everyone their medical record. And we're also fundraising that allows us to approach new markets. In the medium term, it's how many countries, how many people can we get up and running, how quickly, and what new data sets can we release to people, what medical records have been unimaginable that are now essential to give to people. 10 years, I don't know, John, but it's so exciting. I'm just like,
That's it. That I knew that was going to be a tricky one, because I can see so many different opportunity spaces, but equally I know that you've got to focus on the immediate. Mo, if there was one thought that you could leave our listeners and viewers with from today's discussion and from the work that you're doing, what would that be?
Go to patientsknowbest.com/register. Get yourself a free record. If this is before June, we may not have data in that record, but after June, you'll have your information. I just think it's so important for you to know what your doctors know about you, and then add to it. One day you'll need it. You'll need to go to the emergency department. One day your family will need to help you out. Just go and get your record. It's really important.
100%. And I highly encourage people to do so. If people want to get in touch with yourself, where's the best place to find you?
I'm a little bit of a LinkedIn nerd, I'm afraid. So if you drop me a line on LinkedIn, I'd love to hear from people there.
Perfect. Amazing. Thank you so much, Mo. This has been absolutely wonderful.
Thank you, John. Really enjoyed it.
Likewise.